For every woman that has hereditary angioedema, it is important for them to have a medication that can control and arrest their attacks. So during childbearing years, they often will want to be on a therapy that would be recommended should they become pregnant. And right now, in terms of the menu of choices, that is C1 inhibitor. In the choices of C1 inhibitor, the recombinant product is Ruconest, and so this would be the plasma-free therapy as opposed to the plasma-derived therapy.
It ended up being a good decision to switch to Ruconest because we ended up getting pregnant sooner than we anticipated. So Remington Grace was born on October 21st, 2018. And she is just this absolute sweetheart. She's now 6 months old, just about. And she's almost crawling, almost trying to talk.
Yeah.
She's got a beautiful smile, beautiful
Full of
eyes.
life, yeah.
Yeah, just smiley and happy, healthy.
Hereditary angioedema is a genetic disorder. If one of your parents has this disorder, the child, it's a flip of a coin. They have a 50-50 chance of inheriting it. Having children is one of the things that back in the day, in particular when we had no good therapy, that people would really struggle with because of the fear of what they'd been through and the thought that they might pass that on to their child and their child might suffer. Fortunately, we now live in a time that's different, that people can look forward to their child would have treatment, even if they have HAE.
When we found out that we were pregnant, we knew that it was imperative that we created a care plan with our doctors. And kudos to Brooke. From day one, she was always an advocate for herself, but now also for the baby.
When we're discussing the prospect of having children, we do need to hope for the best and plan for the worst. People need to be aware that their condition may worsen during pregnancy. It may get better, it may stay the same. But all of the people involved in that pregnancy, start to finish, need to be informed about hereditary angioedema, what it is, what can happen, how to treat it.
During my second trimester of pregnancy, I started swelling severely. I went from an abdominal sweller to a facial throat sweller, which is definitely very scary when your airway is in jeopardy. And it was very hard on us. And my insecurities with my illness, his worries with my illness, and Remy just became the new foundation and our ground of strength for us, for both of us. It was immediately like all the pain and suffering and everything we went through that felt so traumatic was not traumatic at all. It was the greatest blessing.
I think that for everyone that has hereditary angioedema, that they are well served having somebody who's expert in their condition, a specialist that is knowledgeable about hereditary angioedema involved in their care. This gives them, in essence, a quarterback, somebody that can help them navigate other areas of the healthcare system to ensure that everybody knows, everybody's ready, everybody's there to help.
What is Ruconest? Ruconest is an injectable medicine that is used to treat acute angioedema attacks in adult and adolescent patients with hereditary angioedema, HAE. Who should not use Ruconest? Do not use Ruconest if you have experienced life-threatening immediate hypersensitivity reactions, including anaphylaxis, to Ruconest or to any other C1 esterase inhibitor product. Call your healthcare professional or the emergency department right away if you experience wheezing, difficulty breathing, chest tightness, lips and gums that turn blue, fast heartbeat, swelling, faintness, rash, or hives. Do not use Ruconest if you have a known or suspected allergy to rabbits or rabbit-derived products. If you do not have a known rabbit allergy, testing is not required. Ruconest is not indicated for use in children under the age of 13 years. What should I tell my healthcare provider before using Ruconest? Tell your healthcare provider about all your medical conditions, including if you have a known allergy to rabbits. Tell your healthcare provider about any other medications you are taking, as some medications, such as birth control pills and certain androgens, can increase risk of clotting problems. Also tell your healthcare provider if you are pregnant, breastfeeding, or planning to do so. Ruconest has not been evaluated in pregnant women or nursing mothers. You and your healthcare provider will decide if Ruconest is right for you. How is Ruconest given? Ruconest will be dissolved in sterile water and slowly injected into your vein. What are the possible effects of Ruconest? The most common side effects patients experience during clinical studies include headache, nausea, and diarrhea. These are not all the possible side effects of Ruconest. If any of the side effects get serious, or if you notice any side effects not listed here, please inform your healthcare provider or pharmacist. You can also report side effects to the FDA at 1-800-FDA-1088 or visit www.fda.gov/medwatch. For product information, please contact Pharming US toll-free at 844-474-2764. For adverse events and product complaint reports, please call 800-930-5221. Please visit www.ruconest.com for full prescribing information, including patient product information.